Opioids are a class of drugs that include prescription pain relievers, such as oxycodone, hydrocodone, and morphine, as well as illegal drugs like heroin. These substances interact with opioid receptors in the brain and body to provide pain relief and produce pleasurable effects. Opioids have a long history of use for medicinal purposes, but they also carry a high risk of addiction and overdose. Prescription opioids are commonly prescribed by healthcare professionals to manage moderate to severe pain. They can be effective in treating acute pain following surgery or injury, as well as chronic pain conditions. However, their misuse and addiction potential have led to a significant public health crisis in many countries, including the United States. When opioids are used for extended periods or taken in higher doses than prescribed, they can lead to physical dependence and addiction. Misuse of prescription opioids, such as taking them without a prescription or in ways not intended by the prescribing physician, can result in serious health consequences. Opioid addiction can be characterized by compulsive drug-seeking behavior, cravings, and a loss of control over drug use. The misuse of prescription opioids has been a contributing factor to the rise in heroin use and opioid-related overdose deaths. As individuals become dependent on prescription opioids, they may turn to illegal opioids like heroin due to its lower cost and availability. The illicit opioid market has been further complicated by the introduction of highly potent synthetic opioids, such as fentanyl, which can be up to 100 times stronger than morphine. The opioid epidemic has had devastating consequences for individuals, families, and communities. Overdose deaths from opioids have reached alarming levels, with thousands of lives lost each year. The impact extends beyond the health sector, affecting public safety, criminal justice, and economic productivity. Efforts to address the opioid crisis have focused on multiple fronts, including public education, prevention, treatment, and policy changes. Initiatives aim to increase awareness about the risks of opioids, improve prescribing practices, expand access to addiction treatment and recovery services, and enhance overdose prevention efforts, such as naloxone distribution. Furthermore, ongoing research is focused on developing alternative pain management strategies to reduce reliance on opioids for pain control. This includes exploring non-opioid medications, physical therapies, and integrative approaches to pain management. In conclusion, opioids play an essential role in managing pain, but also carry significant risks of addiction and overdose. The misuse and abuse of opioids have led to a public health crisis, impacting individuals and communities worldwide. Addressing the opioid epidemic requires a comprehensive approach involving education, prevention, treatment, and policy changes to reduce the harm associated with opioid use and improve pain management strategies.